Good afternoon, everybody, and welcome to this week's campus COVID briefing. Thanks for joining us. Of course, today we'll have both live captioning and ASL translation available, and a recording of today's session will be posted later in the day. Today we'll be able to go until 2 p.m. and we'll get to as many questions as we can. Please use the Q&A function as always for your questions. We'll continue to host these briefings bi-weekly. On Fridays, when there's no campus briefing, Michigan Medicine will be hosting town halls for the U of M community. Today, as usual, we're joined by Provost Collins, Vice President for Student Life, Martino Harmon, Chief Health Officer, Dr. Preeti Malani, Dr. Rob Ernst, Chair of the Campus Health Response Committee, Dana Habers, Chief Department Administrator in Radiology, who's one of the co-leads of Michigan Medicine's Vaccination and Therapeutics Task Force, Rich Holcomb, Associate Vice President for Human Resources, and each of these guests will answer questions from their own areas. So without further ado, I'm going to turn it over to Dr. Malani for an update and then to moderate the questions. Preeti?
Yeah, thank you so much. And I am going to talk about cases on campus and vaccines with our colleagues, but I just wanted to spend a few minutes talking about where we are overall. This week, some of the communications folks and I had a conversation around this notion of hitting the wall. And that's an expression that comes from long distance running usually. It's that moment in a marathon or another long race where your energy is completely depleted and you're overwhelmed, not just with fatigue, but with negativity. And I think for many of us, we can relate to this because COVID, a year into this, we are hitting that pandemic wall. And although there's not like one easy, simple way to remedy all of this, there are some things that we can do to make things a little bit better. And what I wanted to do was just sort of talk about this. One of the difficulties is the uncertainty. And I think this is especially for our students who are trying to think about next year and next summer when it's almost impossible to even think about what next week might look like. So remember, have some compassion for yourself and others. This is a very extraordinarily unusual and difficult time. So, be good to yourself. And I think, do the best you can. One of the things I also suggest is thinking about all the things that create stress for you. This might be a roommate. It might be a particular friend or a frenemy. You might want to use that term. Social media, the news, could be your academic work or research. And, one of the things that I would suggest is really thinking about what you can do to sort of control and manage this stress. Maybe you could put your phone away for a few hours, get rid of some of the Instagram apps and things. And one thing that I think we can all do a little bit better is surrounding ourselves with people that bring positive energy. And on the flip side, making sure we also bring positive energy to others. And, I'm looking over at my friend, Dr. Ernst, and, just our conversations for the last year. And, I think for me, he's been that positive energy and also that person for me to complain to sometimes. So you need both of those things. I also just encourage everyone to just take care of your body. And by that, I mean, get some activity, get some fresh air, go outside. Don't stay inside for 3-4 days in a row, even though it's cold. Think about what you're eating and drinking, get enough sleep. Being connected to others is a really important part of the mission experience for our student. And as we've discussed on this town hall, loneliness on campus isn't new. The pandemic has undoubtedly made it a lot worse. And we're a big campus. And when it's remote, for the most part, it is a little harder to go out and find your people. And what I tell my own children is to really think about what you can do and not always focusing on what you can't do. And there are just great examples of students finding ways to make friends, stay connected, either virtually or in small groups. But it does require a little more effort this year. Many of our students have found meaning by helping others. So, share your talents with the entire community. And for students who are struggling with all the disruption brought on by the pandemic, it is helpful to talk things through. And remember, there are no wrong doors, Dean of Students, CAPS. And I always like to make a plug for wellness coaching at Wolverine Wellness. And that's really about helping set goals and really come up with strategies to help you thrive. And of course, your academic advisors. So I actually am feeling really hopeful. I feel like I kind of hit this wall myself a couple months ago. We have work to do in the meantime, but I am hopeful that things are going to continue to get better. Unlike the last couple miles of a marathon, this is going to be, easier than what we've done. So let's remember to show each other some kindness and patience as we keep moving forward. And I'm going to turn over now to Dr. Ernst. We have some questions that will be for him. So, Rob, it's been a busy week or two. You sort of said to me, we've been kind of on the cooling rack and we're back under the broiler. And I know it's been a little bit different since school started and again this semester, and you were here a couple of weeks ago. But tell us about what's happened with the county stay-in-place recommendation, what's going on campus.
Yeah. Well, this was a similar kind of intervention that we enacted in the fall in partnership with the county. And what we saw this go round was a sort of a flattening of the increase in the case counts, but we're still seeing a lot of positive cases. So when we did this back in the fall, it occurred at a time when we were seeing a lot of cases in the residence halls on campus. And I think that quieted that activity a lot, and we saw a drop off. This time, the demographics of where we're seeing the cases a little bit different. We're not seeing many cases on campus in the residence halls due to the lower density and I think probably the more close supervision of the testing program that we have in place for residents. But we're still seeing a lot of cases off campus. There was a flattening of that rate during the stay in place period, and allowed some of our systems for case investigation and contact tracing to catch up. But we're worried because we're tracking these cases back to off-campus social activities, and that's driving the counts up.
Yeah, I wanted to just give a shout out to all the people doing the heavy lifting of the contract tracing. And one of the great things is that the turnaround time on the case investigation, and this is being led by Angela Beck, Danielle Sheen, and others, many others. But I just wanted to, and under your leadership, Rob. So
it's really difficult work, and this when we see the cases come in bunches after a party or something like that, that really is disruptive to these systems. And the teams are working really hard and trying to keep the rest of the community safe. So we're fortunate. We've had a lot of space dedicated to quarantine and isolation. We're not in any trouble there in terms of capacity. But yeah, the people who are working in these systems are really dedicated.
Yeah, just a shout out. It's difficult work. So this is a question we got a lot of this week around graduate students. And again, some of this has been updated in the last few days. Do graduate students need to be tested for COVID-19 during the weeks when we are not going to campus and self-quarantining at home?
Yeah, this is a good question. This is related to the shift we've had in the mandates that are in place for the winter semester. Through consultation with our public health advisors, the recommendation was to expand the pool. It had previously been in place just for undergrad students who were living or accessing the campus for work or education, to now include the graduate and professional students. So certainly for the graduate students who are living in university housing, the expectation is to access our testing weekly. And for those who are enrolled in classes designated as being in person, yeah, we expect that the students access a test weekly. We're working with individuals who, find that designation might not be accurate. And we have a lot of folks that we're, working with one-on-one to get them out of that follow-up monitoring, if that's the case. But we're also working with other groups to say, let's make the testing more convenient for them. So for instance, for the professional students, we are going to be altering the hours of the testing that's available at the Towsley Center to conform with the feedback that we got for times when it would be easier around their schedules. So yeah, that's the expectation.
Yeah, great. And I think with graduate students, there's a big diversity. They're probably as a group much more diverse than our undergraduates in terms of where they live and what they do. And so there's a process, but be patient. It takes a while to get through all this. And there'll be a little bit more detailed information going back. I know we're going to actually talk about this in a second. Masks, a lot of information on masking. And I think you and I had some discussion this morning on this. What's your thought on double masks?
First off, I think that masking is one of the most important strategies that people can utilize to prevent either spreading or acquiring the infection. So the most important thing is to wear a mask when you're around others who aren't part of your household. The next most important thing is to make sure that the mask is worn appropriately so that it's covering the nose and the chin. And then the third part is that it's a snug fit. So it's, it is, a lot been made of wearing a double mask as being more protective. But I think that if you have a well-fitted mask that's worn properly, it's very, very effective. And again, I think for our population, the occurrences that we're seeing is probably social interactions and settings where people aren't as compliant with actually even wearing a mask than it is a double mask. So this is something that is been echoed by our colleagues at the state. Dr. Caldoun, I heard a really good interview with her yesterday or the day before, talking about just the importance of masking is the really important point.
I sort of joke that double masking means I wear a mask and you wear a mask. And again, wearing a mask, and what we don't want is people to feel like they need to have a surgical mask or that there's going to be a run on those. Those are very expensive and they're in short supply. And frankly, in the medical setting, we also don't want people wearing cloth masks because there's certain infection control issues there. So I know Lorraine Washer and her team are going to be putting out some additional guidance at Michigan Medicine. And the leadership at the CDC, including Director Walensky, said, listen, tight fitting, snug fitting mask is what matters. So again, something comfortable, make sure you're washing it often and wear it. Why are clinical students, so medical, dental, pharmacy, nursing, et cetera, who are rotating in the hospital and largely vaccinated, required to be tested while other medical professionals are not?
Yeah, it's a good question also. And we are certainly hearing a lot from some of these groups. The dental schools had a mandate in place for their students actually for the whole fall. So there's no change for the dental students, but for the other health profession students, like the other graduate students, we've moved to this expanded list of mandates because of what we're seeing in terms of the shift in the demographics of cases. So we had seen comparatively fewer cases amongst the graduate and professional students back in the fall, higher percentage now. Good question about the vaccine. And I think we're going to be figuring out, the role of the vaccine for the public health response over the coming months. The really impressive data that's been shown in terms of effectiveness of vaccine was in its ability to prevent clinical illness. And there's comparatively less information right now about the ability to acquire asymptomatic infection and to spread it to others. So in the student population at this point, the recommendation is to continue to do the weekly testing regardless of the vaccine history. That may change. A lot of things with the pandemic and the response have shifted over time. Is something we'll be watching.
Yeah, and despite some of the issues we're having on campus, overall as a state, we're really doing well. We're actually doing better than just about any other state. And in fact, the whole country is doing better, even though globally, United States is much higher in cases than most nations. So, I think we could be in a very different space. Even 2 weeks from now, if we have you back at the town hall, we may have more guidance on this. And this has been one of the many humbling things about the pandemic is that what in the morning could be different in the afternoon. So thanks, Rob, for all your work, superhero work. Keep it up. Take care of yourself. And I'm sure we'll have some more questions during the open question time. And we'll move on actually now to Provost Collins with some questions on from the academic arena. So welcome. Will there be changes to the grading policy for the spring and summer terms?
First of all, good afternoon, everybody. Good to see you. And thanks for a question that we have certainly been getting. I had asked a group of deans to consider how we should approach grading for the spring and summer terms that are coming up soon. And their recommendation, which I have accepted, is that we'll continue the system that we have in place for this current semester throughout the spring and summer term. And this is really because the instructional situation that we expect for spring, summer 2021 will be really similar to where we are this semester, with most classes still remote, students managing a lot of uncertainty and stressors. And we also know that this doesn't affect all students equally or equitably. I do want to note that while we're keeping our grading system the same throughout the entire 2021 academic year, we do recognize that we had different systems in place both last winter and also over the last spring, summer half terms. And we've decided not to go back and revisit those decisions about grading that we made for those semesters. Just quickly, more generally, our plans for the spring and summer terms are well underway. With respect to the University of Michigan classes, we would anticipate spring and summer, again, would look quite similar to the current semester in terms of the mix of remote, hybrid, and in-person. And the ability to hold classes in person as appropriate would extend to rising first-year student offerings as well as some of the activities that take place at University of Michigan facilities outside of Ann Arbor. So we'll have additional information forthcoming about other kinds of activities beyond the university classes that typically occur on our campuses in the spring and summer, and we'll be providing that in the coming weeks.
Great, thank you. And what insights did we gain from the fall course evaluations?
Yeah, and that's another good question. The data from the fall 2020 courses were actually recently compiled, and so I'm happy to share out some of the information about the results. I do want to note that there'll be a record article with additional information that'll be out very soon. First, I do want to stress once again the importance of using care and being mindful of the context if evaluations are used for courses that are taught during the pandemic for any type of faculty review, annual reviews, promotion and tenure reviews, et cetera. So the response rate was 43%. And that's similar to the rate for the last winter, but it is below the typical response rates we have of about 50%. We did add a few new questions this time that enable us to disaggregate the data by course modality. And we asked questions about how they participated and what were the main challenges and some of the things that worked well. So overall, and I think this is important to stress, the student course assessments are really quite similar to what we've seen in past semesters. So what I mean by that is the medians for the university-wide questions are the same as they have been in prior terms. And for the instructor-specific questions, the medians are either the same or actually a bit higher than we've seen in prior terms. So students do report somewhat higher or heavier, I should say, workload. And that actually primarily reflects the views of students who are taking remote courses relative to those who were in hybrid or in-person courses. And of course, that finding is similar to what we've heard from students in other ways. It's quite consistent with that information. Students list a number of challenges that they faced, and those included staying motivated and focused, the challenges that many had with technology and connectivity, time zone differences, and again, the workload issue that I've mentioned. They also identify a number of teaching methods that they found particularly effective, and those include a variety of different types of discussions that happened in many of the classes that they took, the creative usage of breakout rooms, Zoom polls, and also guest speakers, which has been one of the, I would say, advantages that many of our instructors have been able to add to the ways that they've been able to teach their courses. These results add to the information that we're gathering about just how to enhance the teaching and learning across our campus. And those are informing our work to support our students and our instructors, and also to plan for our future semesters.
Yeah, that's great. It sounds like there's a lot of really rich information that no matter what the fall might look like will be useful, since some of this technology, especially the point about guest speakers, I think is really, I've actually been invited to several classes, kind of a range of classes, which I'm sure I wouldn't have been able to do during a normal time. So thank you so much. I think we can now move on to student life. Vice President Harmon. So this is like one of the $1 million questions. What will university housing look like in the fall?
Hello, Preeti, and hello, everyone, and happy Friday. That's a great question and a very timely question. we are in the process now of examining possible scenarios for a more residential fall and consulting institutional, local, and national public health guidance to understand what sort of risk are involved with the decision. Ultimately, fall occupancy is a decision with institutional impact. So we will receive feedback from a variety of stakeholders that will inform the decision. Public health officials, although we would love to think that fall will be back to normal, but health officials advise us that we should expect safety measures to continue, even as we look at vaccinating people across the country and across the world. We're still planning proactively for different scenarios based on everything we've learned. This includes testing, masking, social distancing, the Responsive Blue app, and other measures. So we're hoping to get back to a new normal fall Michigan experience. And I know that the lessons that we've learned now will continue to serve us next semester and long after the pandemic has eventually ended.
Yeah, I think I like the idea of a new normal. I would say a more normal is my hope. And honestly, it's all a guess. That is unfortunate in the sense that you have to do the planning now, and that's why we've got to look at scenarios. But for people who listen to that and get discouraged, I would say, I think it will be much more normal. That's my guess anyway. But we certainly have to plan for a variety of scenarios, and there's a lot of good things could happen between now and then. So let's talk about large social gatherings off campus, and particularly some of the things happening in fraternity, sorority life, and really in other large settings too. What's being done?
So I'll address the situation in general. It's a really tough situation. We hear about concerns about dangerous social gatherings and that they really violate public health policies, but we consider individual accountability and group accountability. So individuals are held accountable through the Statement of Student Rights and Responsibilities, while student organizations are held accountable through our student organization accountability process. Individual students can be found responsible if they've violated public health guidance, and it can be recorded in a disciplinary file with the university, and they could face suspension. These records, if you are held accountable, these records matter when you go on to apply for graduate school or other opportunities. Student groups found to be in violation of group accountability standards could lose recognition and privileges with the university, such as funding, on-campus recruitment, use of campus resources, and other official status as a university-affiliated group. And this has happened even during the fall and at the beginning of the winter semester. So we have developed a strong set of escalated intervention measures for students living at addresses off campus with repeated interactions with local authorities for violation of public health ordinances. And we recognize how COVID-19 goes against the natural desire to gather and socialize. We understand that, but this is a critical time. As you mentioned, the last few laps of the race, but this is a really important time for us to really buckle down and pay full attention and commitment to the Wolverine culture of care. The way we overcome this pandemic is by doing it all together and staying committed. So we will continue to enforce, and we will look for escalated opportunities, but we really need students to just be committed. This hopefully will be the last semester like this. And if we just stay committed, we can get through this and end up in a better place.
Yeah, I agree with that fully. And, I will just say too, that there is this narrative always that, everyone is having these large social gatherings when the truth is that's a minority of students. And in fact, what I see are many, many students trying very hard. They're holding each other accountable. They have roommate agreements. In fact, I think they're doing better than a lot of people in the general community. And Ernst and I talk about this all the time, that campus can't be safer than the general community. And we are in a bit of a microcosm of the world where there's a portion of people who it's business as usual. There's a portion that are trying not to go anywhere, which is also not good. And then most of us are in the middle trying to figure out ways to move forward. So I do want to also congratulate all those students who are working so hard to find ways forward, because this is unfair to you. I'm sorry that this is happening, but I'm really inspired by how hard they're working.
Thank you.
Great. So we're going to move on now to vaccination update, and we're really fortunate to have Dana Habers with us. She has been here with us before, and she's one of the key members, one of the co-chairs for the Michigan Medicine's vaccine distribution committee. I can't remember the full name, Dana. So lots of questions for us here. I don't know if the next slide has the questions, but otherwise I can. Okay, yes, they're here. So these are some questions, and we can have a bit of a conversation, because I know this is also something that is changing moment to moment, and it was frankly a little more optimistic early on, and then less so. So we'd love to just hear from you, and where are things right now with vaccines?
Thanks, Dr. Malani. Appreciate being invited back. Happy Friday, everybody. I am a co-chair of the COVID-19 Vaccine and Therapeutics Task Force. So we like the word task force. It's been constant changes, I think, since we started this work back in October. Most recently, I think, just to acknowledge up front, a really challenging time in that we have not had vaccine supply. So a lot of our plans and a lot of what this looks like going forward will continue to depend on the supply of vaccine. But I am optimistic. I think we're seeing really positive signs. In January, there were a couple of different layers of plans that started to roll out, one from our federal administration and the Biden administration coming in, and then also at the state level. And I think if I could summarize kind of the transition we're in, we started out of the gate as very much owners as a health system of the deployment of the vaccines that we were getting into the state. So the large hospitals and health systems stood up mass vaccination sites. As you all know, we've got the stadium still running and have had the Ford and Danto auditoriums up and are now closed. We have a facility out at Brighton still administering second doses this week. So we built infrastructure and started to really funnel through and go quickly through those doses, administering over 90% of what we received every week out into the community. So some really great early progress. But I think what we're seeing now is a further distribution and an effort from the state's perspective to try to give more access points. So there's a broader plan, and it involves both redistribution of doses to counties. So there will be more doses going to counties than there will be to hospitals, and also additional locations that will be vaccinating. So we're already starting to hear Meyer, for example, in the Lower Peninsula, Rite Aid and Cardinal up in the UP are getting doses, receiving doses directly from the federal level. So I think that equates to more locations and more vaccine overall, but we're in this really awkward toddler phase in between, sort of trying to figure out what that looks like and how that will work going forward. I know it's been a frustrating couple of weeks for our patients and for the members of our community who are in 1B, who are ready and geared up, and we sent communications out and said we're ready to go, and then simultaneously saw a significant decline in the vaccine supply. But we're hearing there's hope and there's more on its way.
Yeah, I think that's what we want to hear. And, I'm just going to make a plug too for signing up for people at places like Myers and Walgreens. I actually, in my own family, my parents, my in-laws were able to get vaccine. They fall under the 1B, and they were able to get vaccine this week at Walgreens. So we were really delighted with that. So, I've been asking people to just give it a couple weeks, and I know that there's a lot of effort being placed on this, and that 1B category is likely to go till April. And that's something that we knew ahead of time. But as things are rolling out, it does feel difficult for people watching. So I just want to acknowledge that. So these are the questions. How will Michigan Medicine and U of M be coordinating with and supporting the Washington County Health Department now that Michigan Medicine is recommending that eligible staff and patients request vaccination there?
Yeah, thank you. And this is all a work in progress. So I don't have, we share what we know and acknowledge that there's a lot that we still don't know. I think similar to you and Rob's conversation earlier. We know that the Washtenaw County Health Department has done a really tremendous job. They stood up a mass vaccination site as well out at the EMU Convocation Center. And they're also doing similar work to us where they're taking out some mobile options and vaccinating in very localized settings to help some of our most vulnerable patients. So that work will continue. They do have a pretty robust capacity. So as long as they're getting vaccine, I am confident that those appointments will open back up through the county as well. At this point, we're just saying register at all of the above, and whoever gets the doses will open up appointments, and you can go as soon as possible. We've talked a lot about our role because we wear so many hats. We are a clinical delivery, at least at the moment of vaccine, and we'll continue to do that as long as we get doses. We've also served in a really important education role, and I think that will continue throughout the course of this entire vaccination program and maybe even beyond into coming years as we circle back and go for year 2 vaccination. I think our role, even though it may not be mass vaccination delivery in a clinical setting, we'll continue to do whatever part we can to get this out. We have fully aligned interests with the county and the state to try to get our population vaccinated as quickly and safely as possible.
Yeah, there's a bit of I don't know if it's a silver lining, but in a sense, like you've had time to really figure out the system, the delivery systems, both at the county level, the state level, and then of course at Michigan Medicine. And I've heard great things about what's happening at Wayne County too, which are our neighboring county. And the numbers I saw is that Washtenaw County has actually done more vaccines than Michigan Medicine has. Now it's about 70,000 versus about 55,000, if I have those numbers correct. So
Yep.
Thank you. So in recent news, I think this was, in fact, I think it might have even been yesterday. It's hard to remember sometimes because so much happens every day. Dr. Fauci shared some news about an increase in vaccine supply, that the general public possibly could be receiving vaccine in April. In fact, I think he called it like open season on vaccines. Does this change the timeline for vaccination for undergraduate students?
Yeah, I do think so. I mean, I watch the dashboards at both the federal and state level all the time, daily, and I'm seeing consistent timeline adjustments. I do think, I know a week ago we were being told that the state of Michigan is going to get a 16% increase in our vaccine supply overall. And then if you add into that, those direct distributions to the retail pharmacy industry, that's incremental vaccine into the state. I do think the efforts will increase the efficiency and move it as quickly as possible. We all, I think in this moment, look forward to the point where the supply of vaccine is adequate to meet the demand, and we're not there yet. And then I think we'll have this new phase of challenges where we're really trying to provide information, help educate on the benefit of the vaccine, and acknowledge the you kind of overcome some of the fears or hesitancies that are going to hold us back from getting to the broader population. So I do think from all of those dashboards, we're looking at a summer timeline for phase 2 in the general population at this time.
Yeah, no, thank you for your comments around hesitancy and being that source of good information, because there's a lot of misinformation on vaccine out there. So again, for people listening in, Michigan Medicine has a number of really great resources, as does the CDC. And data, I look at that CDC tracker, it reminds me of the people who look at our dashboard around cases. And it actually makes me happy to see it. And it's actually a lot of really good data. And if you've seen nationally, the last several days, the overall distribution hasn't been as good, just because the supply is down, but it should get boosted with hopefully a new vaccine, maybe even later this month.
Correct.
As the Johnson & Johnson has applied for their emergency use authorization.
Yes.
So great. Thank you so much. I'm going to turn it back over to President Schlissel to introduce our next guest.
So thanks, Preeti, and thanks again, Dana. Our next guest is Rich Holcomb, the head of HR for campus. And as Provost Collins noted last week, we want to share the results of the staff survey today, along with an update on the work of the Workplace Innovation and Staff Experience Committee, cleverly called the WISE Committee. It was led by Pam Gable, who's in charge of the Service Center, and it was charged with providing recommendations to help staff members sustain their work as a campus emerges from the pandemic. So let me turn it over to you, Rich. Thanks for joining us today.
Good afternoon, everybody, and thank you for having me today. So in December, University Human Resources conducted a staff survey of all the Ann Arbor campus staff. So it went to over 12,000 individuals. And it was on a variety of different topics related to COVID and our current work situation. And we were trying to get a sense of what are some of the challenges and issues that staff are facing. And what I wanted to do is share with you some of the highlights of that staff survey. One of the most striking things from the survey is out of the respondents, 87% of the individuals expressed an interest in continuing to have remote work presence options available after the pandemic, of working at least one day in a remote fashion. We knew kind of anecdotally that we had heard from a lot of units that individuals had expressed interest. And we also know that from the survey that faculty and staff have also said that their department has really successfully adapted pretty well to working in a remote fashion. We also heard from individuals that have been working on site during this time, and most said they understand why they are working on site given the nature of their work, but that doesn't mean it's always been easy or without its challenges. So we're going to continue to focus on how do we create a future of work for those working on site or those working in a hybrid or remote fashion. 40% of the respondents indicated that there has been a disruption in this past year for dependent care related needs. And so we knew that was definitely a concern and an issue. And I'll talk more in just a moment about that on some new programs that we've set up on the next slide here in a moment. 2/3 of the individuals surveyed expressed concerns around stress, burnout, work-life challenges, et cetera. And we know that continues to be a challenge for our workforce. Even before pandemic, these were issues of concern that we were focusing on as an organization. I think it's important to look at and utilize the services that we have through our programs and our faculty, staff, and consultation office and our Office of Counseling and Workplace Resilience. One of the very important aspects that we had heard as well from the survey is that over 80% of the respondents indicated that they're getting good communications from their managers and their leaders, that the communications that they're hearing at the university level from their departments and supervisors are very effective. And so I want to first thank all the managers and supervisors that are on this call today and continue to ask you and encourage you to keep sharing the information with your staff because it's been very effective. And I think having this type of town hall continues to be an effective source of continuing to communicate. Finally, 70% of those that were surveyed expressed an interest in receiving the vaccine. And as Dana was just talking about, changes in adjustment and the availability of vaccine, and we're continuing to focus on that. I would expect even that number, since we did this survey, has probably increased, given the fact that we've heard very favorable outcomes and people's interests around the vaccine seems to be fairly strong. But again, encouraging people to access the resources to get more information about the vaccine. The full report for the staff survey can be found on the Campus Blueprint website so that you're able to view a little bit more of the details within that. I think one of the important things about the survey is it will help guide us a bit into how we think about the future of work and as we consider our strategies going forward and what's important to our community. On the next slide, as I had mentioned to you a moment ago, we launched a couple of new programs in the past few weeks. One was care.com. It provides access to a national network of care providers, child care providers, nannies, tutors, pet sitters, and many more, where they've pre-screened the individuals and allows for our faculty or staff to connect potentially with these resources. We also launched a family-to-family posting board to help employees connect with one another to share free support with one another. And as I would mention earlier from the prior slide, we've seen certainly an increase in the issues around mental health and well-being and concerns. Our faculty and staff and counseling and consultation office, FASCO, and Office of Counseling and Workplace Resilience, or OCWR, have really risen to the challenge. They pivoted to providing virtual visits for individuals, individual sessions, group sessions. They're really providing a number of different resources available. And you can access more information through the link that you see listed here on the presentation for mental and emotional health related services. As we transition to the next phase, as President Sissel indicated, with the future of work, the WISE committee that was meeting and working through the fall period of time developed a number of different recommendations to help guide us and help us think about what the future of work could look like, focusing on flexibility, how we might adapt to creating an environment where we have individuals working on site, hybrid fashion, in person, or remotely. So really looking at all the different elements. And I think flexibility is one of the really key elements of the WISE committee recommendations. As we go forward with the WISE committee recommendations, the next step is there's a group that is being formed, a committee, to help provide some guidelines and principles that will guide how we may consider and think about operationalizing the many WISE committee recommendations. It's also going to be important that as we work to operationalize the recommendations of the WISE committee, that we gather your input and feedback out how to most effectively do that. So a copy of the full WISE committee report can be found on the campus Maize and Blue Blueprint website, but you can rest assured we will be out talking with groups, gathering more feedback, getting your input as we look to how do we operationalize and create a sustainable future together. Now, I know many of you are probably wondering, it's almost a year. Preeti was talking about hitting the wall. Yeah, I think I hit that wall in December myself, and you certainly become fatigued, challenged by it all. But as stated, the end is in sight. We can kind of see the finish line, and we have to continue to persevere. And I think that's one of the things as we continue to work in the fashion we're doing. Many of you have asked, what are our future plans? We've communicated broadly that you could expect to continue to work in the fashion you're working, remote, hybrid, et cetera, through the end of this winter semester, which is into April. But we now know that that's probably too soon, and we need to extend that out through at least in the end of June for our community to know that working remotely is going to continue to be in the cadence of activity. And so as we go forward, we are committed to making sure that we provide you all with good notice so that we have a well-informed, safe, gradual return to what is our new normal and how work will look like. And we've learned through this whole process, flexibility and adaptability is key. So again, I think we will communicate out that through the end of June, you should expect at least then for us to be working in the fashion we're doing. But we'll continue to monitor that situation as more information becomes available, and be very transparent and continue to communicate. The health and well-being of our faculty and staff is the most important thing. So we will continue to refocus on that and how we have a safe return. Thank you.
Yeah, thanks, Rich. I remember like a year ago talking to you about all this, and we couldn't have never imagined this. So
yeah.
So thanks again very much, Rich, too. And Preeti, you're going to help moderate questions for our remaining time this afternoon.
Yeah, I would love to do that. And I think the first question is for you around the rationale for the decision to do a virtual commencement.
Yeah, this is yet another one of these really both difficult and unhappy decisions that we've had to make through the course of the pandemic, because I think everybody wants the ability to celebrate the achievements of our graduates. And a Michigan degree is not an easy thing to obtain, and families are incredibly proud, as are the students. So we really have wanted to find appropriate ways to celebrate. We involved students as well as campus leaders and deans and staff and others in trying to figure out what we'd be able to do. But at the end of the day, as Rich was saying, it's the health of our community that was paramount in making the decision. If we had people come to town for a ceremony, that'd be dangerous, having people go back and forth during a pandemic. If we did an event with students only in the big house, right now there's a cap of 100 people in venues, so we couldn't do a big house ceremony. We considered breaking down into many smaller ceremonies, one school or college at a time. But even those involve hundreds of people, including staff and vendors and others that have to come and actually put on these ceremonies. It was so hard to predict what the state of the pandemic and the extent of vaccination is going to be at the end of April, the very first day of May. And also we thought it was important for both families and students to have clarity far enough in advance to make plans. We didn't want to leave open the possibility of doing something in person, only having to disappoint people a couple of weeks out. So you add all that up, and unfortunately we had to make the call based on the best information we had and guidance from our public health folks and input from students and faculty and other leaders to go fully remote. We'll do a very high value synchronous graduation with a production company helping us, lots of student involvement in the graduation, ways to give folks their diplomas virtually. We'll attract a really exciting speaker and have other performers. But we also promise to invite students back at a later date for any graduation ceremony they'd like to attend. And we're also thinking of some kind of special event over the summer, but more likely in the fall, as the pandemic comes under better control, to invite folks back to campus to celebrate their accomplishments appropriately.
That will be great. I can't wait. So, and again, unknowns. So the next question is, how is the hospital situation for COVID cases in Ann Arbor and around Michigan currently? I would also be interested to hear if we have protocols for treating COVID now, and if lives are able to be saved now that might not have been last year. And I think I'll take on this question. Things are okay in the hospital. They're certainly not like they were in the spring. I think the counts today were like 30-ish, maybe about 10 to 12 in the ICU. And I actually recently was rounding on a number of patients, and we do have better protocols for treatment. And without getting into too much detail, I think in one particular thing we've learned is the use of steroids and how helpful that is. But all the other treatments, interestingly enough, they're kind of incremental. There's not one easy thing that changes everything. The remdesivir, the monoclonal antibodies. The other piece that we're doing that I would say is really important, it's less about the hospital, but more about people in the outpatient setting, are the use of monoclonal antibodies in people who have high risk for severe infection, trying to get testing done early, trying to get turnaround early, and then treating people who fall under high risk categories. Again, it's incremental, but it does appear that this therapy helps decrease the risk of hospitalization and death, which are, of course, very, very important endpoints. But I also say that, COVID, we measure hospitalizations and deaths because those are easy things to measure. And there are a lot of other downsides to this, particularly the post-acute COVID, and we're still learning. But, I would say that we are in a much better place, but there's still not a simple way to treat this that beyond supportive therapy. Okay, this next question I'm going to give to my friend, Dr. Ernst. Will vaccination status ever replace the need for weekly COVID testing? I understand that vaccinated people may still be carriers, but will they also need to quarantine if testing positive? And again, we can also talk about sort of emerging changes in quarantine recommendations in general.
Yeah, this was news this week. The CDC came out with some guidance to suggest, as we're prioritizing our response, the group of folks who have completed their vaccine completely and then have a couple of weeks beyond their second dose for the mRNA vaccines could be considered for not having to quarantine if they would have otherwise been, considered a close contact. And then they, like we do for after an acute documented illness, say, give a 3-month grace period. This is just guidance that is emerging. It's something that's under consideration by our teams right now in consultation with the MDHHS and the county health department, because we align our practices with the public health agencies in the county and the state. And this is something that's being discussed, and it may be something that we adopt, but we're not going to do it independent from the health department.
Yeah, so more to come on that. This was a recommendation that came forth like a couple of days ago. But I think the fact that it's coming is reflective of the fact that we are probably going to get a lot more guidance with the current CDC and the current director. She's actually a parent of a couple of college age students. So I know that she's very interested in what happens on campus. So good, thank you. So this next question, let's give this one to Rich. When will we know more about the university's financial situation, especially as it relates to hiring or merit promotion, or actually to Provost Collins, or promotion raises at the end of the fiscal year here? So.
Yep, thank you. I'm happy to take this one. And first of all, we fully recognize that the budget restrictions have been really challenging for people across campus, and also that the challenges tend to grow the longer those restrictions are maintained. And so we really appreciate just the vigilance and the effort it's taken across our university to adhere to the guidance. And of course, people are really eager to hear when we're going to return to more normal conditions. So while I don't have an announcement that I can make yet, the university will gradually be reducing, or relaxing, I should say, the restrictions on expenditures as our financial position strengthens and as some of those uncertainties increasingly are resolved. And so we do expect to be communicating out more information in the coming weeks.
Great, thank you. And I don't know, Rich, if you probably don't have anything specific to add to that, or do you want any comments? No.
Oh, I think what Provost Collins indicated is very helpful, because you're absolutely right. We've received that question about when, might some certain activities begin to resume. And as Provost Collins indicated, I think that her and her team are looking carefully at that in terms of how do we begin to have a gradual return back to, some more normal state. So thank you.
Yeah, it's great that we are able to even ask this question, because I remember last year as we were ramping down, it was pretty dire discussion. So I think, again, lots of reasons to be hopeful. So this is a question, and I'm going to throw this either to Rob or Martino, or the two of them. How is compliance with the new testing mandate for all students being managed? What happens when students don't complete the testing requirements?
I can talk about how we're managing it. That we've made a lot of progress on tracking the at least for students who are using the U of M testing resources, either at the saliva-based sampling program for asymptomatic surveillance, or through UHS, or even at the hospital. We have really developed a nice dashboard for tracking compliance, and we can break those data down based upon students who are residing in university housing, or students who are enrolled in classes that have been designated as having an in-person component to it. And then we can even break them down even further to individual residence halls, or to individual school and college affiliation. And we've got a team of really hardworking folks who have been managing this. The good news is that for students that we have closest access to, those students who are living in university housing, we have really high levels of compliance with weekly testing right now. It's approaching 98%. So we have, in many dorms, either 100% compliance or just handfuls of students, that we have to follow up with directly. The extended groups, for those who are in hybrid or in-person classes, has been a harder group to manage, because we can it requires a lot of follow-up one-on-one with those students. And what we're finding is that what's defined as a hybrid class may be a choice for the students to say, you can be in person if you like, or you can be fully remote. And we're finding that some of those students have chosen to stay at their permanent address and just be fully remote. So there's been a lot of work being done to try and reconcile that in-person instruction cohort. But a lot of work being done to track down those folks and really watching the compliance with it.
The only thing I would add is that, we've got a great group that's doing the follow-up and tracking students down. And if that doesn't work, if we have, just constant non-compliance, we don't want to limit MCARD access, but that's possible. And we don't want to put students through the Oscar process because, you've got a student that's going through a process, but still really needs to be tested. But we can do that if we need to, and we will do that if we need to. So it's sort of a layered approach to gain compliance with a lot of different touch points throughout the way.
Okay, great. Maybe one more question here. This one for Dana. There are still some questions, Dana, around Michigan Medicine, sort of the prioritization of employees for the vaccine. Can you just talk about that process a little bit?
Yeah, thank you. The prioritization all along has been part of our efforts to align to both the CDC and the ACIP recommendations, as well as the state of Michigan. So we've tried to stay in sync with that guidance all along. And that's founded in several things. It's meant to address not only personal health risk and get the vaccine to those who are most devastated by the impact of COVID, but also to keep infrastructure running, keep systems up and running. And that was one of the early priority tiers around, healthcare workers and making sure that we had the ability to take care and continue to take care of COVID and non-COVID patients despite cases across the country really spiking. I think the continued prioritization, it's been really difficult in 1B because of the scale. We have a lot of our population age 65 and up, and then we have these additional frontline essential workers who are members of our security and police task force, our security personnel across campus and within the health system. And then there's sort of this competition for appointments and vaccines while they're limited with patients who are elderly and really vulnerable. So we're in a difficult stage, but we continue to stay aligned to the state and confident that we're doing our best to not only stop the spread of COVID and distribute it in a way that we're functioning as a society, but also helping the people that are most likely to get sick if they do get COVID.
Yeah, thanks, Dana. It's imperfect for sure. I'm going to turn it back over to President Schlissel to close us out.
Thanks, Preeti. The report that Rich Holcomb referred to, we'll send out a link to that report in my email that goes out today, summarizing today's session and also pointing out some other things. So we will send around the link for those of you that couldn't find it on the website. I also want to make one point that goes back to an early part of our conversation, particularly focused at our students, but more broadly. It's a wonderful thing, and we're fortunate that younger people tend not to get seriously ill or hospitalized with COVID-19. However, every time someone gets infected, the virus has a chance to mutate or evolve every infection. And as you know, we're struggling as a society to deal with variants to the virus, the B.1.1.7 variant that's more transmissible. So as if we didn't have enough reasons to take care of one another, even though you're unlikely to get seriously ill or hospitalized as a 20-something-year-old, for the sake of the broader society and preventing the virus from evolving to be more dangerous more quickly, I really urge everybody to follow the kind of guidance that Preeti and others that we all actually know as we try to make it through this home stretch until more vaccines available. And we're all geared up to give it to as many people as quickly as we get supply. So let me encourage folks just to hang in there and do their very, very best for many, many different reasons. So with that, I'll end. I'll thank today's participants. We'll take a look at the questions that came in during the talks today that we were unable to get to. We'll put some more FAQs up and we'll try to answer some of these the next time we get together, if not sooner, through other means. So thanks again. Stay healthy, everybody, and go blue.